Welcome back. Recently, the FDA announced an emergency use authorization for the use of convalescent plasma. So joining us this morning is Brad Bryan, the CEO of Houchin Community Blood Bank, to explain what that means for plasma donations and treatment here in Kern County. Brad, thanks for joining us this morning.
Hey, thanks for having me.
Absolutely. So first off, tell us what this authorization means and for Houchin and both Kern County patients.
Yeah, sure. So previously, convalescent plasma was under an investigational new drug status, and that's really about testing safety. The safety's been proven of this, and the FDA moved into the next step of emergency use authorization. And really what that means is testing efficacy. How well does it work? Again, this is an experimental drug, and there's no real good treatments for convalescent or for COVID-19. For patients here in Kern County, they're not going to see a difference. They're still going to get their convalescent plasma if the hospitals order that. The good thing about the emergency use authorization is a lot of the burdensome paperwork that the hospitals had to do for an investigational new drug are taken away, and so a lot of that burden is removed.
Talk about the need for plasma donations here locally. Are you seeing people come out and donate?
Yes, we've had over 200 donors come to our center and donate plasma, and the great thing about that is everyone who donates, that plasma can go into up to 5 people here in Kern County, and it stays here in Kern County, which is the great thing. And if you look at the numbers of patients in ICU beds and the mortality rate, it's dropping significantly. And we've heard from a lot of the doctors in the hospitals that they strongly believe the convalescent plasma is contributing to that.
For people who may not have had a positive test but feel that they had some sort of sickness and it could be COVID, are you asking them to come in and donate now as well, as long as they don't have any symptoms, just in case they might have those antibodies?
Well, if you think you had COVID-19 but you didn't actually get a diagnostic test, you can still come in and donate blood, and we will test your blood. We'll even give you the results of that. We'll test your blood to see if you have antibodies against COVID-19. If you do, then you can come back and you can donate convalescent plasma at a later date.
And you're providing some incentives for people to get out there and donate, as if helping COVID-19 patients wasn't big enough. But you guys are also offering some monetary things. Tell us about that.
Yeah, certainly. So a lot of the local restaurants have been really impacted by the shutdown. So we've partnered with many of these restaurants to help them because they're struggling. We're going in and we're buying a ton of gift certificates from them. And then they're matching our purchase, a lot of them. And then we give out $50 gift certificates to local restaurants, to anybody who comes in and donates convalescent plasma.
What are some of the restaurants? Provide some more incentives for people watching.
Oh, come on, you name it. We just, yesterday it was Frugati's, we have Smitten. There's a lot of them. There's a lot of them. We'll have it on our social media.
Got it. And for people, let's say they had COVID in March and they have since recovered. That's almost 5 months ago now. Are those people still eligible to come in and donate their plasma?
They are. Please come in.
Awesome. All right. Brad Bryan, thank you so much for joining us this morning. We're going to have all these details on our website, turn23.com. Brad, thanks again.
Thanks a lot.